Welcome to the office. How are you today? Any change today?
There's a change.
A little bit of a change.
Yes.
So I want to recap what I found and what the most important thing for me for you is, okay?
Okay.
I know you got a pain in your butt in your right side. I know that. You have that rotated sacrum. The sacrum is doing better. It's between, that 5 is the special listing. So it's the sacrum rotated and down. We got a piece of it. But that 5 is going to give you, it's between that 5 and sacrum. And it's figuring out that combo for you.
Okay.
Okay?
Okay.
That's really it. Everything else is bonus.
Okay.
Okay?
Got it.
And you know what you need to work on.
Yes.
Yes?
Yes.
Let's do this.
You're great.
Shasha, you want to tell her? It's a 5-pointer. That's the one. That's the one. That and a tiny bit up top. But I don't want to mess with any of that. I want to just focus everything on this L5. That's where I want to be with you. Come back slowly towards me. Talk to me. Feedback.
That hurts.
Same as earlier, more or less?
Same. More. Nothing.
5. That's what I'm showing you. Now, here's what I need from you. One simple thing. You're gonna go on the knee chest table. You're gonna do some cat camel stretches. You're gonna receive.
Okay.
That's it.
Okay.
All right, let's
Yeah.
do it. Tummy up, tummy down. Do that several times. So guys, I'm gonna review really quickly what a special listing is. A special listing, she has an L5 PLS-M. And what that is this. So she has a posterior left superior L5, but it's in a concavity. So we have to be on the opposite AP or pillar, and we have to push it this way and torque like that, this way, this way, this way. And the only challenge with her with that is that rotated sacrum. Put your knees slightly together. Slightly together. Good. More tender there. Yes, that's the one. So I'm on the AP. I'm on the opposite side. And I'm torquing it into me this way. Let that tummy go down, please. Good. Gotcha. That's it. Come up slowly, please. That wasn't so bad.
No.
Come on. Walk it in.
It like knocks the wind out of you for a second. Yeah. I feel like I'm walking straighter. And
You
then-
see, it's not a crack though, it's a
No,
set.
Yeah. Wow.
And I don't know how to describe that to
Neither do
people.
I. I can't describe it. The swelling,
It's getting worse.
yeah.
So tomorrow we got a big day, okay?
Okay.
Tomorrow's a big day. And tomorrow is Thursday. Tomorrow is your movement. Tomorrow is your letting go of that stuff.
Got it.
Starting the process. Figuring out your happy medium. ¿Entiendes?
Sí, señor.
See. And you'll see the vid that I'm doing here, dude. This shit is clear. Oh, shit. Shit. Let's go back. Do back slowly. Tell me what's going on here.
I'm like, I can go all the way back if you'd like.
Limbo. Come on.
Yeah, this is fine. It's a little sore.
Tailbone.
Fine. Fine. It's when you put your. Fine. Fine.
Tight.
Yeah.
Not sharp.
Yeah.
I'm going harder right now.
Okay.
Stand up.
Is it feeling?
You tell me.
Yeah, a little. That's
A little
wild. Wow. I can't believe that.
What are you talking about?
Wow.
Well, what?
I can't believe that.
What?
I'm filling out.
You filling out?
I'm filling my.
I'm like Botox, you know? Squeeze. Squeeze. Dr. Rahim's like Botox. I'll share one not funny story, but a pretty cool story. I was visiting New York. This was years ago. This was before I even opened a clinic up. Visiting some family out there. And a guy who knew me when I was a kid came to say hi. Right? We still live out in New York. So I just became a chiropractor. Squeeze. So anyway, he had this thing he mentioned. It's a really cool story, and I didn't realize the power of chiropractic. I mean, I did, but this was another cool one. Mm-hmm. So he's like, Rahim, I fell off a curb, slipped off the curb, hit my back, went unconscious for like 2-3 minutes. And somebody helped me off the street, took me to the hospital, blah, blah, blah. 2-3 days later, he goes, all of a sudden, muscle started to disappear on his quad. Mm-hmm. Quad is 4 muscles, right? Mm-hmm. It was the middle one. Whoever knows that one, you can write a comment. So this was basically, so you see the muscle, and then it's skin on bone.
Wow.
And I'm like, I don't know. But I just adjusted what I found, which was L4.
And it filled it back up?
He didn't tell me this till the next year I went.
Wild.
I adjusted him 3 times. And he goes, I don't know what the hell. He didn't call me, he didn't tell me. But the whole muscle came back.
Did it?
No shit.
As soon as my whole one comes back.
You let me know.
You
Let us know, Squeeze.
Yes.
But I'm just sharing that story because there is the nerve component that controls that muscle. Squeeze. Ready for a nose job?
Yeah.
On your back.
I'm not nervous.
Look down. It's there. Breathe in and out. It's already going.
Yeah, I felt that.
Breathe in. Breathe in. Chin down.
Oh my God, I feel immediate change.
Come on up.
What a difference. Wow.
Jokes aside.
Wow. My pressure is going away. That's so weird. That's so weird. Feels amazing.
You tripping.
I'm telling you, I'm
Why are you
freaking out. I'm shocked. Because I came in for like other things and then other things are happening. It's awesome. Cut.
What?
Cut.
Cut. Squeeze. Squeeze. Stand up. Walk it out and breathe. Make sure you're good. You're at a hotel or Airbnb?
Hotel.
Okay. So do they have a steam room where you're at? Or is it
no steam room.
No problem. You want to do some steam.
Okay.
All right. So whatever you need to do to get some steam, but definitely when you get back, lots
For
and lots.
here?
Yes.
Okay.
And typically the way I recommend steam after a deviated nasal septum adjustment that I perform is boil a pot of water, cover yourself with a towel sheet, topless, and just sweat it all out.
Okay.
And do that like every day for a good 2 weeks.
What's coming out? Mucus?
All this stuff.
Oh yeah? Okay.
So whatever stuff needs to come out, let it out, okay?
Okay.
Tell them. What happened?
I just said I can breathe. I don't
Come
think
here.
any stuff is coming out. I feel like
Come
I can suck it all back in.
Look.
It's wild.
That actually snaps nice.
I felt like I got
That's
punched in
nice.
the face.
Yeah.
And then it just all opened. My headache is gone though. Do you think it was like pressure? I don't know.
We'll find out by
That was
tomorrow.
fantastic.
Take care.
Thank you. Thank you.
You're welcome. Natalia!
See.
Hola.
Hi.
How are you?
Hi.
Manishma. How are you?
I'm doing okay today.
Okay, so we had a few days so far, right?
Yes.
And I know you were a little nervous in the beginning. I'm sure you're still nervous, and that's okay. But you understand what I'm doing?
Yes, I do
Yeah.
understand.
Okay. And we had a little change this morning, hopefully.
We did.
Okay. So the combo that we found is actually different from the x-ray. So here's a great example of we have to go with the patient, not the x-ray. And the combo we found for her was not the EX as it shows on the x-ray. The combo was the IN ilium with the L5. That was your combo.
It was great.
So you walked today?
I walked all day.
A little bit better today?
Yes, a
Okay.
lot better.
All right, you ready to go?
Yes.
Let's take a look. I just want to show this part because this is important. So what we ended up doing here, I want to make sure you can see it good. It shows that there's an EX here. It shows that there's a rotated sacrum on the right. Now the x-ray is based on a listing system, but in actuality, we have to go with what the patient presented, which was a right IN ilium. It goes against a couple of things. It goes against the fact that it's listed on the left. It goes against when you have a rotated sacrum on the side of an IN ilium or an ASIN or an AS ilium, you go with the rotated sacrum. Page 43 of the chapters, guys. So this is, again, another perfect example. We have to go with the
Patient.
patient. It's not about the film.
But the patient has to be patient.
The patient
Which
has
I
to be
wasn't
patient,
so
and she was
patient.
getting a little bit, you know, you get jonesing a little
I was a
bit,
little
right?
bit, yes.
And it's most patients.
Yeah.
You're coming from far. I get it, okay? But you gotta trust the process.
Agreed.
Even if you don't trust me, trust yourself.
Right.
You ready?
I'm ready.
Showtime. The back is clear, dude. Very nice. We're gonna go with your L5. L5, 5 points. 6 points. Now, here's the interesting part there. Let's see. What?
I'm telling you.
What?
It's wild.
Okay, guys, I'm
It's
touching your
wild.
glute, you know
Yeah,
that.
yeah,
But
yes.
you know why I'm touching your
Yes.
glute? Why am I touching your glute?
Because of the indent that I came in here with.
What's going on with that
It's
indent?
filling for some magical reason.
It's filling out.
And I didn't work out in 2 days.
Back slowly. You are walking though, right?
Yes, a lot.
Good. We're gonna continue on, okay?
Mhm.
We're gonna do the IN ilium and we're gonna do the L5. Oh, yeah. All right, left ear down. Nice and buttery. Nice and buttery. Now we got the IN ilium. Now you wanna get the cobra?
Oh, yeah?
You gotta wanna get the cobra left side down.
I've been waiting.
Yeah, you wanna get the cobra. All right, peeps. IN ilium. So the moral of the story here is go with the patient, right?
Right.
IN ilium. Easy peasy. Easy. Stealing my thunder.
Okay, take
You
that.
got the bite of the cobra already. Oh, nice. Very nice. Come on. She's smiling at least. Walk it out. And then the cobra gotta get her nose today too.
No, I can't.
Oh no.
I can't do
Oh
it
no
anymore.
Why?
It's way too sore. I can't even blow my nose.
PLS-M. So PLS dash. Yeah. Turn it down. Good. So we got a torque to close the PLS. That's it. That's it. That's it. That's it. What?
I just feel like I could breathe differently.
What?
It feels good.
Tell me how the glutes are feeling here. Do the
Yeah.
do the hips.
I
Open
have to
and
lay
close.
down to do
Do
it.
what you gotta do.
It's like, I don't even want to do it because I don't feel anything, so I don't want to move anything
No, I
around.
want you to. I'm here.
No, it feels good. It really feels good.
You're scared.
I'm scared to change it. Feels
Go back.
great.
Go back.
Oh,
Don't be scared.
it's the first time in 13 years I have not felt it, you know? So I don't want to like, it's fine. It's really fine. I
To
can't
the other
believe
side.
it. It's fine.
You're hesitating.
No, I'm not.
You sure?
I'm telling you I'm not.
You trying to pack your bag?
Oh, I did it by accident. Did you hear it?
You're
Oh my
fine.
God. No, it's not there, and that makes me so happy.
13 years?
13.
Neck is clear. Nice. Not bad. So I'm starting Saturdays back up again. Saturday's gonna be casual Saturday. Let's see what kind of. Oh wow. Heat. No break. Feet together. Open and close the knees. Open and close. Feet are touching.
Yeah, no, not
Left side only. Right side only. Diferente.
Yes.
Walk it out one last time. I didn't get that drop.
It was the same as
I
yours.
didn't- I didn't get
I did
that
both.
drop.
I didn't get yours. I got that
I
one.
didn't get that drop. Squeeze. Squeeze. Hey.
What? I have a question.
What?
When adjustments don't hold, is the reason because we're not fit or like doing something to
Good question.
strengthen our?
Well, if adjustments don't hold, what are we supposed to be doing? Because the idea is this, let's keep it simple first. Depending on the severity of the misalignment and how long you've had it, right? Let's take this as an example. This is optimal relationship, parallel disc, bone, disc, bone. Now, when it misaligns, let's say, it's out of alignment. I'm exaggerating the misalignment. The ligaments have shortened scar tissue, muscles, all that stuff. We make the adjustment forward, it wants to creep back. We make the adjustment forward, wants to creep back. But each time, it's a little bit less. Like today, there wasn't a lot.
Okay.
You felt it?
Yes, yes.
It moved, but it wasn't a lot.
Right.
Okay, cool. Now, the idea now is what? The movement, the posture. It's like the alignment of the car. You're driving to work, you're hitting those potholes, you get your car aligned. Don't hit the same potholes.
Right.
So in your case, it means what? You're doing your walks, you're minding your posture, you're standing all day, I know that. You gotta make sure you're moving around, you're not just standing.
No, I'm never just.
Okay, so you're moving around, you're icing, you're doing those things. This is not about going to the gym and working out right now. Elliptical with a handle. Number one rehabilitative exercise for the spine is cross-country skiing.
But the knees hurt when you do that.
Do it backwards then.
Okay.
They hurt less.
Okay.
Number one is that. Number two is going to be swimming.
Okay.
Number three is going to be walking. Number four is going to be, number three is going to be bicycle. Number four is going to be walking. Number four is going to be running. And number five is going to be walking.
Okay.
So those are your top five.
And why not heat? You said no heat.
Heat, if there's inflammation in the joint, we're adding heat to an inflamed joint.
Oh.
Doesn't make sense.
I sleep with
Ice.
heating pad.
Where? On your back? You can heat your butt, but ice your back.
Okay.
You can heat the glute all day long,
All right.
but you ice the back. Otherwise, the inflammation doesn't come down.
Got it.
Make sense?
Yes, perfect. Thank you.
I see you tomorrow.
See you tomorrow.